Is it possible to reimagine kidney care to improve outcomes and reduce costs for millions of our fellow Americans? Our next guest, Chris Riopelle, believes deeply that the answer is yes, and he is tackling this challenge as co-founder and CEO of Strive Health. With over 2 decades of healthcare leadership experience, Chris brings a unique perspective to transforming kidney care delivery. Driven by a passion to help underserved patients, he's leading Strive's innovative approach of combining technology-enabled interventions with local provider integration. Under Chris's leadership, Strive has improved care quality while significantly reducing hospitalizations and costs. While together, Chris shares how Strive Health is partnering with payers and providers to create an integrated care delivery system, supporting patients from chronic to end-stage kidney disease. Join us as we explore how Chris and his team of Strivers are pioneering value-based kidney care and reshaping the future of health and care. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Chris. A big welcome to our podcast today.
Great to be here, Mike. Honored to be a part of the program.
Well, given your deep expertise in leading transformative healthcare companies and your passion to improve the lives of underserved patients living with kidney disease from chronic through end stage, I'm honored to have you on the show for this important conversation. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Chris, it's almost time for our community to learn how you and the Strive Health team are partnering with providers and payers to provide complete kidney care for patients in a value-based setting. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
The one piece of advice is don't be afraid to break all the dishes. Do not let insurmountable things that appear in front of you to become your reality. Healthcare needs to change. And if we don't break the dishes, we're never gonna.
Chris, I am so glad we are starting off right where you just mentioned breaking the dishes. Sometimes we got to get those elbows sharpened up a bit in the china shop, if you will. We need it, right? But I think you can also agree, right? This is a complex industry. You know, there's a lot of entrepreneurs that are on the show that are much earlier stage than where you and the team at Strive Health are. And one thing that I've heard time and again, yes, we need to break dishes, but we also have to understand how were the dishes made in the first place, right? This is a very complex industry, multi-sided industry, as you know. Couldn't agree more. We definitely need to break those dishes. There's a lot of work that needs to be done, and I know it can be done. We can move this industry forward by doing it together. But would you also agree with that as well, making sure that we understand the complexities of where to take this dish breaking, if you will, because again, there's so many moving parts and we have to make sure we're understanding where we are going with things, especially with innovative models like Strive Health, which I know we'll be diving into here in a moment.
Completely agree. When we began to scope out the potential of Strive, there were 19 reasons that I identified why this would never work. Most of those were baked into the history of kidney care in America and how patients learned of their illness, how they were treated, and how much our system was not taking care of them before and during their kidney decline. And it's such an opportunity. And so we've chopped away at every one of those 19. Some of them are still there structurally, but a whole bunch of them have been displaced by hard work, good policy, and the commitment of companies like Strive and our Strivers.
And is that also a part of the culture, if you will, inside of Strive in regards to this dish breaking, right? Hey, take some risk, right? Obviously, we always have to remember that we have to keep the patient in front and center and that we have to remember that this is healthcare after all. But still, I also say it's a mindset about taking risks. Don't be afraid to break things, right? Just like you mentioned, breaking those dishes. Is that part of the culture inside of Strive as well?
Absolutely. First of all, we are a patient-centered place. We are here to transform kidney care in America, and we're doing it every day. We're seeing thousands of patients a day, and we are changing the course of their care. And so we've got a deep commitment from our Strivers, that's what we call our employees, to the patient first. And there was a fearlessness of coming to this business that was a PowerPoint deck and two people in my garage 5.5 years ago. And so it took a lot of pioneers to be here and want to make a difference. But the patient matters first, foremost, and always, followed by their families who rely on them. And in our company, what's next is our strivers. That's who matter a great deal to me.
Well, Chris, you set the stage perfectly for the bulk of our conversation. We're going to discuss all the things that you and all the strivers are doing to take care of those patients and to move kidney care transformation forward in our industry and in our country. We're going to discuss all that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Chris Riopelle, co-founder and CEO at Strive Health. Chris, breaking dishes, absolutely love it, pushing it forward. Got to change this industry. We can do it inside this industry. I know we can. If we can put a person on the moon 50 years ago as a nation, I know we can move healthcare forward. And with mindsets just like yours, we are certainly going to go there and make this happen. Chris, you mentioned it a little bit right before the break. 5+ years now, a PowerPoint deck, 2 guys in a garage. Got to hear a little bit about the founder's story, how this all came together. Where were those aha moments? Then, of course, we'll discuss what's the good trouble Strive Health is causing today, where you see things heading for tomorrow, not only with the organization, but, of course, for our listeners, where the industry is heading as well and what we need to be mindful of. And then, of course, Chris, how we can be helping you out. But first, take us back a bit. Take us on the journey. How did Strive Health come to focus and where did it come to be? Where were those aha moments? Give us a little bit of backdrop on how this all came to be in the first place.
Yeah, be honored to. So I've been doing this almost 30 years, right? Taking my time, my energy, my commitment, and spending it inside healthcare organizations that were focused on at-risk populations, from long-term care and skilled nursing to at-risk primary care in my 20s when I had hair, to a decade in the dialysis business, both with Gambro and DaVita. At the last opportunity I had was to help grow an anesthesia company. And at the end of that investment, we were selling that business, I was really committed to finding a part of healthcare where we either failed at chronic conditions or we failed in transitions. And so I looked at every part of sort of post-acute palliative care, hospice, back in long-term care. And the idea of changing kidney care was not first on my mind, because in my mind, I'd been there, done that, and appreciated all of the structural dependencies in disrupting that part of healthcare. But then I met my co-founder, Will Stokes, and we started to pull apart the art of the possible. And clearly, if your rubric and lens was, can we do better on chronic condition management? And can we do better on transitions? Kidney care is a giant part that intersects around those two things. We spend $420 billion a year on this disease state. And everyone continues to think most days that kidney care means dialysis. Sure, it's a very important part of the care delivery. It's about 35 or $40 billion of that spend. And the dialysis companies are really, really critical to the life, health, and wellness and survival of these patients. And they do a damn good job delivering dialysis. They just haven't historically been involved in anything else. And where the patients are seeing poor outcomes, where the patients are seeing accelerated declines in kidney functions, are all the places that aren't the dialysis center. So how do we get involved with these patients was the notion of the beginning. And so for me, this is a culmination of my entire life's work to help people in healthcare that need it. And 121,000 patients sitting here today later, I know we're helping people and we're helping them every day, making their life better, extending their life, and improving their quality of care.
Wow, absolutely powerful. Now, a couple things you mentioned, Chris, on the front of $450 billion annually we're spending on this disease state. Frame it up a little bit more for our community tuning in. I have to imagine that is also touching other comorbidities or impacting other areas of a patient's care journey or their health overall.
100%. So these patients, typically a late-stage kidney patient has 5 comorbid conditions. They take 20 medications. They have a very complex healthcare life that takes a lot of intention, a lot of coordination, a lot of attendance, a lot of compliance and adherence. And so these are complex patients. They have hypertension. They have diabetes. They have congestive heart failure. They have perhaps morbid obesity. And so they are a complex patient that requires all of the resources that we have in this country. They're massive. They're amazing. No one is pulling them together for these patients the way that Strive and other value-based kidney care providers are doing today. And so they're complex. They need our help. And in this country right now, I'll tell you this, we can do better than we're doing today. 37 million Americans have kidney disease. 10% are diagnosed. Sitting here today, still 60% of patients crash onto dialysis. 40% of patients, the first time they meet a nephrologist is when they're in the ICU and their kidneys have failed and they've got to pick a dialysis center. In this country, with our resources, we can do so much better than that.
Well, let's talk about doing better. Let's dive into it. Let's dive into the Strive Health, who you are, what you're up to, what's the good trouble you're causing. I know you've done it before. Give us that elevator pitch. Who is Strive Health?
We're fundamentally transforming kidney care by starting with the patient first. What's interesting about these patients, I mentioned the comorbid conditions and the medications and the constant access to the healthcare system. A premise from the beginning was, man, there's a ton of data in the system, claims, hospital systems, EMRs about these patients. Is anybody organizing it and normalizing it and putting it to work? So amazingly, nobody was, right? And so we have an unbelievable data environment we've created to ingest historic claims data, live lab data, discharge data, organize it, normalize it in a way that we can put together our over 40 now data science and machine learning models to make sure we can predict when are Mike's kidneys going to fail. We can predict with over 90% accuracy the month your kidneys are going to fail. They're not going to fail. You're going to be fine, I'm sure. But if they were, I would make sure that you knew. And so the power of that data, when you organize it and put it into the world of what we call our care multiplier, this is our proprietary platform for putting that data to work into the hands of the most important part of our business, which are our kidney heroes. Think nurse practitioner, RN, social worker, physician in some cases, dietitian, making sure that care team is aiming their resources at the right patient at the right time. And that data feeds our care multiplier platform. So we're doing it thoughtfully, efficiently, and accurately to deliver care to these patients. Not just care coordination, but actually delivering care in the home, in their doctor's office, wherever we can meet them, we will get there and engage with that patient. And so it's a technology-enabled direct care delivery model that ultimately is improving a patient's life and extending their lives, reducing the heck out of healthcare costs, and having all of our constituents really, really pleased in a win-win-win. Payers or risk-bearing providers win because we engage with them to improve the care of those members or patients and reduce the cost. The patient and their families win every time, and our strivers, over 650 of them today, who are here for a reason, not just because it's a job. Jobs are everywhere. If you want to be part of something that changes healthcare and changes someone's life, that can be done at Strive, and it's happening because our constituents are all winning in this process. So we're delighted to be part of this industry change, and it ain't going away.
Absolutely love it, Chris. And you can tell and sense the passion behind this. I can tell this is your life's work, and I absolutely just love spending time with leaders like you that are just embodying what we know can be true and this change that we can drive. Let's talk about also, Chris, we can get excited about the technologies of the companies that we build, but you know as well as I do, what really matters most is the feedback from those end users, those constituents. And you just talked about them a little bit. What has the feedback been like from whether it be those providers that you're helping support, whether it be those patients? What has the feedback been like from those constituents since you guys have been around?
It's been fantastic, right? So you live, you learn, you work hard, you improve every year, every quarter. But let's start with the payers. The payers for years, frankly, were concerned about these patients. They were very expensive. They had no mechanism to manage cost and expense. The payers understood they were lost in this complex system. And it wasn't until they were on dialysis that a payer could really predict and understand the cost structure of these patients. And so the payers now have a solution to say, we will take these patients at stage 3B through end-stage renal disease, and we're going to engage them. We're going to enroll them. We're going to engage them, and we're going to change the course of their care. And so the payers who historically weren't really excited about having a lot of these patients in their, say, Medicare Advantage plans are now really confident because they have partners like Strive to get there. The patient satisfaction is 94%. These are patients who no one is reaching out to help them because they're so chronic. Someone will call and say, I'm from the diabetes program. No, this is someone who says, I am going to be a part of your entire mosaic of care that you need, and we're going to be with you all the way. It might be, did you see the cardiologist? We have the medication forms. Did you fill those out? So the patient constituent, because our team is amazing and because no one is helping them, we have had amazing positive feedback. And then for our strivers, right, the ability to get involved in a preventive aspect of healthcare. With so many people, a decent percentage spent time in and around lots of parts of healthcare, including dialysis, including nephrology practices. And the number of caregivers that have said, Chris, I'm so proud that I finally get to help sooner than before. Before, when they got to my dialysis center, I did an amazing job delivering great care to them, but it was kind of towards the end. I didn't get a chance to slow it down or delay the progression. And now I really feel like I'm doing this upstream work that changes how I practice my craft as a caregiver. And so every constituent base is having a refreshing, amazing, positive reaction to what we're doing.
And let's also talk kind of a little at a macro level, and for the layperson tuning in, Chris, why is the Strive Health model ready for now? Why is it fitting for today's market, for today's dynamics, say, versus 10 or 15 years ago? Why is it well positioned for today's landscape in healthcare?
Look, I think finally, after 20 plus years of talking about value-based care, moving from the 80s even in the HMO world, we finally have an environment that's ready to consider coordination of activities in healthcare. These patients aren't getting any cheaper. They are a gigantic portion of the Medicare budget, and the Medicare program was in the same spot. No way to manage these patients other than they had great dialysis providers that delivered really good dialysis. Otherwise, the patients were left to access healthcare however they could. And so I think ultimately we are seeing the opportunity because finally, we've been saying VBC for 20 plus years. There are enough mechanisms between payers, between the government, between providers who are saying, you know what, this fee-for-service program, it isn't going to be here forever. They're all coming together to say, we know it's hard. We know it's not going to be something that happens overnight. But we're going to lean into this because it ain't going away. And we want to make sure that it's as good as it can be, as fast as it can be. And so whether that's payers partnering with companies like Strive, whether it's the government creating really important pilot programs like the CKCC program, all of these things are impetus to say, everywhere I go, governments, private industry, the provider environment is saying, how do we make this happen? Our heads cannot be in the sand any longer. We got to make it work because it's not going to be a light switch moment. It's going to take a long time to get this all to work really, really well.
Well, let's talk about that, exactly where we want to go next with the conversation, Chris, a little future state, right? As you mentioned, it's been taking a while and it's going to take a while. This stuff isn't going to happen overnight. But what are you seeing in the captain's chair, say, over the next kind of 2 to 3 to 5 years for the industry that we need to be mindful of? And then, of course, at that intersection, where is Strive Health going to be as well?
Yeah, look, it's a golden age for specialty value-based care, in my opinion. Here's why. So a lot of VBC got motivated and activated through the transfer of risk from MA plans to primary care providers who were taking on risk. Some great companies from Oak Street, one of our proudest clients, to Agilon, to Privia, to you name it, ChenMed, all these companies really organized with MA plans the ability to deliver some intensive primary care to patients that are older Americans. And so that business organized patients and it got them engaged in a way they weren't engaged before. And so the next generation of that, driven by some regulatory changes called version 28, is a focus not just on getting the patients in and making sure we're accurately capturing all of their health conditions, which is really important in this world of at-risk primary care. But now we've got to really bend the cost curve. And I think even the greatest primary care teams are acknowledging, you know what, when it comes to bending the cost curve on this complex patient, we need a specialist. We need a partner. to integrate with us, not just say, here are the patients, let us know how it went, but to really partner together to deliver a differentiated form of care. So because version 28, which is for the benefit of the audience, an HCC coding change that's come out of the Medicare program, really is driving people to look at cost. And when you want to look at cost in care delivery, there are 4 or 5 specialties that are always on the top of the list, and kidney's the top 1 or 2 at all times. And so as this primary care risk-bearing world is moving toward saving money more than they were before, the specialty platforms, whether it's kidney or cancer or MSK, are all so well positioned to really be on their game and partner with the right groups and create huge value for everybody. And so we think it's an absolute amazing time to be in specialty value-based care. And of those specialties, I mean, believe it or not, I'm still pretending that I'm sitting in my garage down the street, but it's still early days. And we are the most mature. Kidney is the most, I had someone tell me last week, you guys are the most mature part of specialty VBC. I thought, mature? I mean, wow, we're just getting warmed up. We're just getting warmed up. So many more patients. We have about 18% of patients in this country that are in programs like us that need to be, right? So like we've got so much grass to mow in terms of getting more patients involved in these programs that I couldn't be more excited about the future. Is a reason to be bullish. And all along the way, regulatory changes has been very positive for us. And this version 28 change is another example of a positive move toward specialty spend needs to be managed.
And you're speaking of, you mentioned there's so many more patients to be enrolled in this type of care. Is the patient population in mass? Yes, we have, like you said, about 18% in it now, but let's look at the late adopters, the laggers, if you will, on an innovation bell curve in regards to the patient. Are they ready for it in mass? I mean, are you feeling, in the next couple of years, these patients are ready for this kind of new way of care?
Look, I think every year they get better and better, whether it's the fact that unfortunately this population is growing in our country. We are not getting healthier as a country. Like we're not going far enough upstream to say maybe that diet choice is a bad one. Maybe that smoking choice is a bad one. But I would say as technology advances, as we have 85-year-old grandmas using a tablet to interface with our caregivers sometimes, we just know we've come a long way in technology and adoption of how healthcare will be. Showing up at your doctor's office every time you're sick and expecting them to get you in week by week is not a strategy. And I think with the evolution of technology and the patient behavior of what is normal, it's normal to talk to a nurse practitioner or a physician's assistant as an extender to the physician. All of those things, you have to put them all together. And it's one of those things like, we don't even realize it's happening, but the changes are massive, but they're happening in small increments. And so I feel really good about this patient population, chunkily, I'll call it, being ready for this. Not every patient will. We can't get to every patient. Some say, look, I'm going to not change my life. I'm doing fine. And that's their prerogative, of course. But if they want to help, we work hard to get them in the program and work with them every day.
Love it. I love it. Chris, let's bring it back to current state. We'll put the crystal ball back on the shelf for now. Let's get to current state and let's talk about how our community, an amazing one, rallied around this podcast, how they can be helping you and all your strivers. What's one problem, need, or question that you and the team have that we can be helping you with?
One of the most exciting things happening in technology as it intersects with healthcare is our favorite topic of artificial intelligence. And in healthcare delivery, there's a tension point, right? You've got experienced, capable caregivers that aren't about to turn over their judgment to some computer model. And so where and how can we, at the right times and the right methodologies, interject artificial intelligence into care delivery for late-stage kidney patients? Of course, we're already using AI and machine learning on the front end, but we're also using it administratively. How can we make notes more crisp? How can we make some of our administrative functions more improved? Over time, AI is going to find itself into care delivery beyond the acceleration of scale, which it's doing for us in a dramatic way. But how does it get into the actual game? And so I think, if we believe artificial intelligence is a disruptor broadly in our society, it needs to have its fair share in care delivery for these late-stage patients. And I'd love to see complex specialty value-based care to be on the cutting edge of artificial intelligence in healthcare. And so ideas, creative thoughts, organizations that could make a difference in this area, that'd be super intriguing because, as you know, and your listeners know, there are a lot of AI things out there, and trying to separate the wheat from the chaff is pretty tough.
Fair enough. And I know we have a fervent community that is working on a lot of those items. So how can they get a hold of you? Can they extend the conversation? Some contact points online, social media handles, websites, or otherwise? How does our community get a hold of you, Chris?
LinkedIn and X, just search at Chris Riopelle or www.strivehealth.com.
Easy enough. And for our listening community, just simply scroll on down into the episode notes of your favorite podcast where you're tuning into this episode to get those contact points for Chris and the team. Or you can head over to our free global online community at passionatepioneers.com, where we will have a post for Chris's episode with all those contact points online and an area to leave any questions, comments, or feedback. Again, over at passionatepioneers.com. Chris, an exciting conversation. I'm fired up. Let's rock and roll. I am all in on what you guys are doing at Strive Health. Love the story. But before we get you out of here, we have one more piece so you can sign off on a high note with our community. It's a fill in the blank. I'm a passionate pioneer because
I have the greatest gift of my life to be surrounded by 650 human beings that are working their butts off to help other human beings who absolutely need it. And it's been the greatest gift of my career. And I'm proud to be a passionate pioneer.
Chris, well done, my friend. Thank you so much. You keep breaking those plates for us. You keep challenging the status quo. Keep getting after it day in and day out. As one fellow Denverite to another, this community here in Colorado is incredibly proud of what you have built, not only in our city and our communities, but of course, everything you're doing across this nation. Thank you for everything you do, Chris. And of course, thank you for spending time on our podcast today.
An honor to be with you all.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.